Welcome, everyone, and thank you for joining us today. Power to Save and the AST Community Education Committee are proud to present today's webinar on the cost of survival, navigating the financial burden of transplantation. Before we begin the main presentation, we do have a few housekeeping notes to help you engage with today's session. There is currently a viewership polling question displayed for the audience. Please take a moment to answer this question while we finish the remaining announcements. This webinar is being recorded, and the archive will be available on the AST YouTube channel 2 to 3 business days after the live session. Please note that all of your lines have been muted so that only the presenters can be heard clearly for the archive recording. If you have a question for our panelists during the webinar, we encourage you to participate by chatting the hosts and panelists or using the Q&A button in your Zoom webinar panel. Please note, the questions submitted via chat may be missed during the presentation, so the Q&A button will give you the best chance for your question to be seen. Finally, when you log off at the conclusion of today's webinar, you will see a link to a short evaluation survey to complete. Please fill out this survey to help us keep our content current and engaging. I will now turn the session over to our moderator, Dr. Isa Ashur of Boston Children's Hospital, to begin our presentation.
Thank you, Brian. On behalf of the Community Education Committee of the American Society of Transplantation, I would like to welcome our panelists and thank all of you attending live with us today. Today's webinar, titled The Cost of Survival, Navigating the Financial Burden of Transplantation, is the first in a planned series of webinars to roll out over the course of the year. We are planning to engage directly with the patient community to explore the financial burden of the transplant process across the continuum of the pre-transplant phase, living donation, and the post-transplant phase. We're going to start today's webinar, the first half, with a recorded conversation that we had with our transplant recipient, Michael, focusing on his challenges in the pre-transplant phase of his journey. Please stay on as we transition to a live Q&A for the second half of the webinar with all our panelists and our special guest, Ms. Gloria Chen, Transplant Social Work Supervisor from Dell Medical Center in Austin, Texas. At this time, we're going to start our video and then join you back for the Q&A portion of the session. Hello, everyone. I'm excited today to introduce this new webinar series from Power to Save. This webinar is produced by the AST Community Education Committee, and it's going to focus on navigating the financial burden of organ transplantation. My name is Isa Ashur. I'm a pediatric kidney doctor at Boston Children's Hospital, and we have a great panel here today. I'm going to let our panelists introduce themselves. Sarah.
Hi, my name is Sarah Lieber, and I'm a transplant hepatologist at UT Southwestern.
Farouk.
Hi, everyone. My name is Farouk Pradhan. I'm a transplant hepatologist at the University of Nebraska Medical Center.
And Michael.
Hey, everyone. My name is Michael Soul. I'm a liver transplant recipient.
Jennifer.
Hello, everybody. My name is Jennifer Ayupa. I'm a transplant pharmacist at the University of Rochester Medical Center.
And Scott.
Hey, everyone. My name is Scott Westfall. I'm an adult kidney transplant nephrologist, also at the University of Nebraska.
So thank you guys today for joining this webinar. We're going to focus on the financial journey that patients have to go through their organ transplant process. As you know, healthcare delivery in the United States and in general is a very complex process. Patients have to go through many different phases as they receive their organ transplant. They have to meet with many physicians, surgeons, nurses, allied health professionals. They have to take multiple tests and procedures. So it's a very long road. And along the way, there's going to be costs associated with it. And with a complex care system comes a very costly healthcare delivery as well. We have financial coordinators at all our transplant centers that try to explain to patients and families their coverages and anticipated expenses, but it's not easy. There's a lot of different things that come into play, starting from health insurance premiums, copays, deductibles, things that are covered or not, and then all different sorts of insurance policies, be it primary, secondary, or even more than that. So obviously, there's a lot of burden that comes with that. And the burden is not just a one-size-fits-all. It's a whole spectrum that starts from just the financial burden itself, progressing into distress, and then potentially even toxicity. So I'm going to let one of our panelists, Sarah, she's done a lot of research in this area, explain this framework a little bit better.
Thanks so much. This is a great conceptual model that was actually published in Liver Transplantation that helps explain the spectrum of experiences that patients and caregivers have, especially in the field of transplantation. And this spectrum goes from financial burden to financial toxicity. And what do these concepts mean? Well, financial burden in delineated in yellow really amounts to what patients and families have to pay for their healthcare costs. And this can include direct out-of-pocket expenses, as well as indirect costs. Like, for example, if you miss out on working and you lose those potential wages because you're so sick and can't remain employed. This burden can lead to significant financial hardship, lots of out-of-pocket costs for caregivers, time spent caregiving for patients, and time away from work. And this can lead to distress. And financial distress can have a lot of ways that it appears. It often leads to patients and caregivers trying to cope with this financial burden in different ways. This can be in material ways, like you use up your savings or assets or declare bankruptcy to pay for these costs. Other families and caregivers might try to change their behaviors, seek out funds, for example, support seeking, like start a GoFundMe page or fundraising of some kind, or sacrifice some finances they would spend on groceries or gas to pay for medical bills. And then, of course, this leads to psychological distress, worrying about their expenses and anxiety. And what we fear at the end of the spectrum is all of these experiences leading to adverse health outcomes for patients. And this is what we describe as financial toxicity. And this is an example of this is because you can't afford your medications, you don't pick up your immunosuppressant medications, then you might have rejection or increased healthcare utilization, increased visits to your healthcare system. And for caregivers, this can amount to significant burden, including depression, anxiety, and worse quality of life. So this is a really important topic that, as Isa mentioned, spreads a gamut of experiences from burden to toxicity.
And I think it's really important for us to understand this burden spectrum in terms of the lived patient experience. So we're fortunate today to have our transplant recipient, Michael, who's graciously agreed to join us in this webinar. And we're going to have a conversation with Michael to kind of explore his experience, specifically today about the pre-transplant phase of his liver transplant journey. So I'm going to open up the floor to our panelists. We're going to have a conversation with Michael to explore his experience in that regard.
So, Michael, today we're going to focus in this webinar on some of your journey before the transplant. And we were hoping you could help us understand when you were going through the evaluation on the wait list, what were some of the biggest financial challenges you faced before your transplantation, and what were you not really prepared for when it came to finances?
Well, I think generally speaking, I didn't, before I spoke to the financial assistance coordinator as part of the evaluation process, I didn't recognize what an expensive process it was in general. Previously in life, I had a few different orthopedic surgeries, and those were very run of the mill when they told me that I had to have a meeting about financial assistance and my financial responsibilities, and that was a bit of it was very surprising, honestly, because I was like, oh, this is healthcare. I have insurance. I should be okay, right? And that was not the case. It didn't matter what kind of insurance I would have. I could still find myself in some financial issues. So, just the depth of it. And when the financial coordinator said to me, this is going to cost you hundreds of thousands of dollars in the scheme of things, now with insurance, it doesn't cost that. But if you weren't, this is what we're looking at here. And that was when I quickly, started to get palms sweating, and I was like, oh my, how am I going to do this while having a job? I already don't feel good. And now what's going to happen? And I think that was really big for me. And prior to that conversation, I had spent a total of like 14 days in the hospital over a couple months period. So I had already, several, bills and procedures. So, I hit my deductible, but, at some point in time, you're like, what's the point that all this is gonna fall down, right? So that was really difficult. And also too, this is something I want, kind of folks to advocate for themselves about, but don't be afraid to ask, like, in addition to my copay, what else might I have to pay for at the end of this? Because there might be a test, there might be something that, insurance is complicated, but I think realizing the breadth of the amount of money that this might cost me was a large thing. And that's when I started to reach out to friends and family too.
Yeah, and hearing about, that time in the hospital, you're still trying to work and reach your deductible. Looking back at that time before transplant, what do you think was some of the major sources of financial burden for you? What was really kind of tough when it came to leading up to extreme medical expenses for you?
Well, certainly the medications, and I know, that's a big part of pre and post transplant, but I was put on a blood thinner because of what led to my liver transplant, and my insurance wouldn't always catch up to when I needed the refill. And so I'd be left with, okay, I only have 2 pills left. I need to take it 2 times a day. So now this kind of falls in an odd spot. I call the pharmacy and they're like, well, we're not going to fill it for the next day because it needs a pre-authorization or something like that. And then, I go to the pharmacy and I ask, hey, can I just pay for a few pills? And it's going to be a couple $100s for a few pills. And the insurance was like, we're also not going to reimburse you for that too. So, that the first time that happened to me, that got in my head, because then I realized, if I don't take my medicine now, I might have another blood clot. Now I'm gonna end up in the hospital, and now I'm gonna, now I'm kind of tornadoing myself in my head, right? So I think that was pretty big. And also too, just not feeling well and knowing I didn't feel well, but okay, I'm gonna go to another doctor's appointment, or like, is this symptom enough for me to feel like I have to go see the physician again, right? Would always kind of come up in my head about things. And then too, at one point in time, I had to start traveling for my doctor's appointments, and I would have to, plane travel, so that cost started to add up as well. So if I needed a procedure or not, we're looking at anywhere between, $250 a month to maybe $500 a month, in terms of that too. And that's, thankfully I had a lot of friends and family around me, and they're the ones who prompted me to, look into a GoFundMe, and then a number of other resources through work as well too.
Thank you, Michael, for sharing your experience. I'm the transplant pharmacist, so I wonder if we could just pause for a moment and talk about one component of that, because there's a lot to digest there. But you brought up the cost of medications in the pre-transplant arena, one of those being a really high cost medication that not only the cost could be a burden, but also it sounds like you had some issues with access to that medication. Which certainly I'm sure put stress on you because of the potential consequences of interrupting therapy, right? In the situation that you were in. So living with liver failure and the cost of medications, I know, can feel very overwhelming for patients at a time when you're already really vulnerable because of your health and the unknown ahead of you. And so, very well, I'm sure, that there's lots of different classes of medications that we have to use to keep you healthy. And that doesn't, in addition to many different types of medications that we use, there are other things on top of that, like blood thinners, that may be required based on some of the medical issues that you're having. And that the cost of medications can be as inexpensive as a generic, but may be hundreds of dollars even with insurance for patients with liver failure for maybe a drug like rifaximin. So I just want to hit home one of the comments that you made, that it's really important to speak with your healthcare provider and be transparent when you're struggling, especially as it relates to medication costs, because there are things that we can do as your healthcare team to help look out for you and to assist with medication access if you're in a situation where you can't get access to your Eliquis or your Apixaban and you don't want to interrupt therapy, or you have a high cost medication and that's become a burden to you and your family and is causing stress for you in your life, because there are a lot of resources out there. And so often in my clinical practice, I find that I think patients feel like this is the cost, my healthcare is important, being compliant with these medications is important. So I have to do what I have to do to get these medications and to stay healthy. But there are so many resources out there. So I just encourage you and everyone that is listening to this webinar to talk to your healthcare team about the struggles that you're facing, because we have so many options as your healthcare team to even choose alternative therapies or to enroll you in programs that can help with the financial component of medication. Speak with your pharmacist. It's like nails on the chalkboard to hear that you couldn't get your medication and you were in these dire straits and there was no one there to help you, and you felt that you had to pay out of cost an expense that your insurance wasn't going to reimburse. So thank you for sharing that. And I just want to harp on the fact that we're all here for patients and there's so many resources out there to help. And we don't want you to feel like you can't get your medication or have to fork over extra money in addition to what you're already paying, because there are ways that we can help and ways we can ease this burden on you. So I know going forward, you and I have spoken a lot, and I know you'll do that. But ask the questions, talk to us. Don't be afraid to share your concerns.
I would also add to that too, Jen, in the situation where, I got there and, they mentioned it was going to be, quite expensive, even for, a couple pills of it. That was when the pharmacist said to me, do you have an RX card? And she helped me while I was in the Walgreens find a one-time prescription that would give me, I think it was like either a $0 copay or it was like $10 maybe. For that one time, and that gave me time to then call insurance and figure that out. And then again, right, that's time on the phone. So I think that's also why it's also, and you're trying to have a job, all that fun stuff. So I think it's important to grab a friend or a family member that's gonna be there for you to kind of help you out in those times, or be able to maybe make those calls, or when you're not feeling motivated to do it because depression is real, to help push you through that too. So it really is utilizing all resources, and it never hurts to ask. And I know that's difficult, but I can't hammer that home enough.
Well, I'm so glad there was a pharmacist that was your advocate in this situation.
Michael, thanks so much for sharing your story. I think this is just so valuable, having the patient experience for this, because it's one thing for us to be on the physician side or on the prescriber side and just know what we would like to have done. But of course, there is that, barriers in place, or that there is rules that have to go through from our end, from patients and insurance, and just navigating that is just so challenging. And I wanted to talk a little bit about one of the things that you brought up about how your pre-transplant care evolved a little bit from being essentially local. And I think you mentioned then eventually needing to travel. I was hoping you could expand a little bit on that with regards to your pre-transplant management.
Yeah, so I currently live in Charleston, South Carolina. And, when I originally had my diagnoses and I was in the hospital for Budd-Chiari syndrome, I had my liver team here. Everybody was great. Everything was good. And then it came to, hey, you might need a liver transplant, which was a difficult conversation in general, right? Gosh, we don't have enough time to talk about that kind of conversation today, but from that point, it was, well, now what are my options? And I went out and I sought a second opinion I knew I wasn't feeling good, but I think it's always good to. I loved my doctors at MUSC. They did a great job with my care, but I think that's also part of being the patient. It's good to, again, if you can, exercise all your options. So I'm originally from New Jersey. That's where all my family is. So I went to New York Presbyterian for a second opinion. And when I saw it was Dr. Fox up there, she mentioned that I would be a good candidate for a living donor. and I'd never heard of that being an option. So she described to me, you know, what a living donor was, the difference between that and a traditional transplant. And it turned out that MUSC just didn't have a living donor program. So now my transplant care turned to, now I have physicians in MUSC that look after me, but now I also have physicians at New York Presbyterian. And now I'm scheduling flights from Charleston to New Jersey, New York area. You know, thankfully I had family and friends that lived up there, so I had lodging, but, you know, plane tickets are expensive. And not only that, you can only look so far ahead in advance for when you might need an appointment, right? So it's not like I could be like, oh, in 4 or 5 months, let me book this ticket when the price is right on Hopper. It was, I need to do it now. So that definitely started to become a burden. I actually ended up changing credit cards to one that had points for miles, because I was like, well, if we're going to do it, might as well accumulate it, and maybe I can get a ride out of this at some point in time.
One thing that often comes up for patients ask me is, you know, can we just do this over telehealth? Is that a possibility? You know, was that ever really an option, or how did that play a role trying to balance you following with your local providers and then your transplant team in New York, you know, still, you know, before transplant, preparing for it? Was that ever really an option, or did you really have to, you know, fly commercial, or just rent a room for a few weeks there?
Telemedicine would actually never really got brought up, and to be honest, I don't know if I ever really asked for it. But I think pre-transplant, for me to get comfortable with the providers, it was important for me to do it in person, and I think if we asked them, it was also important for them too.
I think you had mentioned that also with the traveling, navigating, working, and time off from work with going in for your evaluation. So can you tell us a little bit about how you juggled that, and ultimately did you have to take time off from work more long term, or switch jobs, or how were you able to navigate that, and you know, the potential lost wages from getting all of this complex medical care across state?
Yeah, that was really tricky. It was tricky because I didn't look well, right? I had jaundice. You know, it created a new relationship with me and my supervisor, that's for sure. I realized from the beginning that I had to be honest with her about everything, and I know that's really tricky for folks because of certain situations. And her and I actually, you know, when I first got diagnosed with some of my liver diagnoses, we talked about, you know, some of the lost time, how to use the PTO in the right way, because I think she was mindful that at some point I might run out, and that's not my fault. So that was a difficult conversation to have with her, because I had to be pretty vulnerable and say, like, hey, listen, like, I'm sick and I kind of need some help here. What can we do? But unfortunately, something that I never accounted for. Now, granted, right now I'm 32. When I got diagnosed with everything, I was 30 years old. I never thought that I should ever apply for disability insurance. That never crossed my mind. I was really healthy heading into everything. We're still trying to figure out, you know, why this all happened. But so when I applied for disability insurance, and again, I was young, naive. I was flying by the seat of my pants when I signed up for my benefits when I got my job. I called up the benefits coordinator and I said, you know, I'd like to start a disability policy. And they said, no problem. When do you think you want to use these funds? I'm like, oh, maybe in a couple months. And they said, well, what's it in relationship to? So I had to divulge some of my personal information on there. And they said, yeah, you can't use a disability policy for that because this is a pre-existing condition. So that was when I realized I'm not going to be having an income once my PTO runs out, and you can only accrue so much PTO. I mean, I was out for about 3 months with my transplant. So that was really when I started that was when I reached out to like some of my friends and family, and yeah, the disability really, that hit me hard, because I was really concerned about what I was going to do for work, because I only had enough PTO for maybe like a month and a half, maybe. And that was with my supervisor being very, very lenient and letting me, not use it certain times. So that was really difficult.
Was there ever a burden on your friends and family helping try and take care of you, whether this was flying up to New York for patient visits or even just getting care locally or how did it impact in their regard, just to make sure that it's a group approach and taking care of you?
Sure. So living in Charleston, all my family is up in New Jersey still. So all this happened after I took a new job down here. So I really didn't know anybody. So, the mental aspect of things, I felt very isolated. I was constantly talking to my friends and family, but nobody was like here physically. And I think, as I reflect on it, that actually affected probably my depression a lot more than I'd like to realize when I was in the moment of things. Because I was depressed and not feeling good, I was not the nicest human. I was probably very ornery towards them. And I still feel really bad about that because I just wasn't always so pleasant to be around. And these people were like, really helping me out and giving me their time. And I will say too, when I did have to apply for FMLA and everything, I should have advocated more for myself with my benefits coordinator here. And a lot of it's because I was afraid. I was afraid to go down this process, so I didn't want to deal with it. I feel like I have a pretty strong character, but at some point in time, I feel like I hit my tipping point. I wanted to put my head in the sand and not worry about it anymore. And I think that's a real feeling.
I think that's a really important facet that you bring up, just the challenges of trying to balance work, then with lost income, then trying to make sure that you've got friends and family there to try and help support you, but also how taxing this can be from a mental health perspective as well. And I'm glad that you're able to find GoFundMe as a resource. And how did you find that in terms of working with them? Do you think that was a positive experience? Is that something you would recommend others to use, perhaps?
Well, 100%. We were able to raise money that covered my lost wages. It was able to account for some of my airplane tickets. It was able to account for some of my medication. We ended up raising over $27,000, which, with my financial coordinator, she said, you're going to have to account for $25,000 to $30,000 in your first year. She's like, I want you to have that in the back of your head and start thinking of ways to go about that. So, the GoFundMe for me was crucial. And, it's interesting. People donated from all over once we start to spread the news on social media. And granted, I'm blessed with really good friends and family who are willing to donate and then share, right? It's like all the interconnectedness and degrees of knowing folks. And that plays a huge part, and I really applaud them. And I think part of the transplant process is obviously being grateful, but then knowing how to say thank you. That's really difficult because there's no way I'll ever be able to thank everybody for their monetary, donations of things. But I can certainly show that through living a good, fruitful life now and helping others out, that was obviously worth it. But GoFundMe was crucial. I know my sister found and this was just specific to the New York area, but they would pay for your flights. So there are resources out there, but you have to find them and Google them, right? But there are resources out there. I always say this whole process made me realize that there are good people out there, right? Because GoFundMe was crucial.
So I'm a kidney person, so I really appreciate learning from your liver experience. The one thing and there may be some kidney people on the call listening, but one thing that's kind of a little bit different on the kidney side of things is people can be on the waiting list for a really long time. The average waiting time is like 4 to 5 years. Some places it's even like 8 to 10 years, navigating, Medicare and ongoing dialysis. So I think it's a little bit different pre-transplant experience, but I think we can certainly learn from each other. So I was kind of curious, what was your sort of process like from the time that you learned you were going to need a transplant to ultimately receiving your transplant? Like, how many visits would that be over time? Because I think kidney is a little bit like the acuity may be a little bit less, but the drawn out long duration just takes a long time. So just in thinking about fundraising and the longevity of needing that fundraising, and thinking like that. So I don't know if you have any thoughts about that, Michael.
Yeah, no, you bring up a good point about dialysis, and I think the majority of the fundraising got done in like 4 months. It was like the big strong momentum, and then it kind of like fizzled out in a sense. I would say your fundraising is tough to keep longevity, so it's important that like when you first start it, if I had to think about like giving someone advice on that, I would say like start it, like hit it hard, and then obviously understand it's going to fizzle out, and it's not going to be an upward all the time, right? Like it's going to be here, come down, maybe come up a little bit again, and that's the way it is. Unfortunately, yeah.
That's helpful.
Michael, I just have a quick question for you. As I'm listening to your story, it sounds to me like you were a really healthy guy going into this, got hit with a ton of bricks, and your whole life changed overnight. And so you probably weren't tied into a lot of resources to help to understand what was available to help you along the way. Were there any social media groups or any connections that you built in this pre-transplant phase to help you to find access to these programs, other patients in similar situations, or anything that you can recommend to other patients with liver failure or chronic diseases that were really good resources to find some of these tools that helped you along the way?
Yeah, good question. I think so, because I was very healthy, so I knew if I need to take care of myself first of all. So, within my own hospital system, and I'm sure like through if your kidney, you're from your nephrologist and heptologist, they can help you with this. But I really wanted to focus on my diet. I couldn't exercise, and I love to exercise, and mindfulness. So I found mindfulness resources within our hospital and a dietitian to make sure that if my body's deteriorating, I'm not doing anything to hurt it. But I think the mindfulness for me really helped calm my mind because I was constantly worried, concerned. Like, again, like this is an unfortunate thought to have, but I always kept thinking like, Mike, I'm 30, 31 years old. Like, what is my quality of life? And like, is this it? And it's difficult when you have that thought to kind of figure out like, okay, well, what's my next step here? Because I was really concerned about my quality of life. So I believe I went down a really dark, path of depression. I really isolated myself, but I bought a dog because I needed a friend and I didn't really have any because I was just new to the area. So I actually got a pet to help keep me, on track, which definitely did not help my financial burden, which was in hindsight, not the best idea. But it helped me mentally. But no, I also felt isolated because I was young and I didn't feel like anybody else young was going through this. And I think that's really unfortunate too. So I don't know if there's any support groups out there. Like I didn't really look to Facebook because I was also kind of like ashamed of myself to some degree because I was this really healthy guy. And then all of a sudden this happened to me. So I'm like, I must have done something wrong. And it wasn't adding up. And I know there's a lot of, like anytime I told somebody I had a liver issue, I felt like they automatically thought that it was due to alcohol usage. And that made me feel like bad about myself, I think, because that wasn't the case. So I was afraid to tell people that like, oh, I have liver issues as well.
Michael, listening to you really hits home, being a pediatric kidney doctor and taking care of children with organ failure. The mental health piece is definitely top of mind for many of our families and parents. Those kids are missing school, they look different than their peers, they get bullied. So it certainly takes a lot of courage to bring up this issue. And I think, for all the listeners on the call, it's okay to be vulnerable and it's okay to share these struggles because we need to address the mental health issue. If you're not able to, live through your life and enjoy it, it doesn't matter what we do to you medically if you're unable to, navigate that mental health piece. So I truly appreciate you sharing this with our audience today.
No, of course. I think a big coming moment for me was when I did go to New York Presbyterian for my second opinion, and I saw Dr. Fox. I got there and I was like, I'm just gonna let it all out. Like, I'm gonna tell her every symptom I have, and I'm gonna tell her that I'm going through some stuff right now, and I'm just going to leave it all out there. And if this is like, you know, how it goes, like, I'm just going to leave it all out there. But I think that's because I got like to a tipping point of it, you know, that vulnerability is big.
Michael, you've shared so much valuable information throughout today, and I think that's just, you've covered so many really, really important topics. This is a tough question, but if we had to summarize one or two key points that, you know, for another patient who is who is on the transplant list or trying to navigate things through eval or how to plan ahead for transplant with liver or other organs. Is there one or two things that you think would be really important to kind of highlight or summarize, or just things for people to know?
Well, one would be like, get an advocate that's going to advocate for you, because you're not always going to advocate for you. That can be a coworker, it could be a friend, it can be anybody. And also, if possible, see if that person can go with you to your doctor's appointments, your physician appointments. You know, at one point in time, I didn't want to advocate for myself anymore, because I said, like, I was afraid and scared, and I would just like show up to my appointments, be like, hey, I don't feel good. Hey, here's your medication. And it's because I wasn't giving the physician everything too, right? And they were still trying to figure things out. But then I started to realize, like, okay, I need to have someone who's for me when I'm not for me. So I think that's really big. And something I know Jen and I talked about was I set up a spreadsheet of everything I did pre-transplant and post-transplant, of my physician appointments, how much did it cost, what was the reason for it. Right, we just talked about the mental health aspect, like therapy, medications, everything, and keeping track of what it all costs, because at some point in time, right, there are points in taxes when you can use, you know, your medical costs for different breaks and things along those lines. And that helps keep me organized, right? And knowing, like, this is what it's going to be this month. Okay, so typically I'm spending $40 a month for my blood work. Okay, I know that's what it's going to be. So it's like budgeting yourself just the way you would normally. But now I'm doing it for my medical expenses as well, which I think that helped put things in perspective. I was resistant to that idea at first because I didn't want to look at it. But ultimately, a good idea, and being able to organize that. And I would say, don't get discouraged, right? If you start a fundraiser and it doesn't go well at first, that's okay. That's perfectly fine. It's not going to go well just right from the start. And don't be afraid to ask. I think that would be like my second bullet point for folks, is don't be afraid to ask. People are willing to help you. There's good people out there. And always be willing to open up that next door, right? Like, go to your place of faith. Don't be afraid to ask the social workers. They're a wealth of resources.
Michael, thank you so much for sharing all of this with us today. I mean, your transparency, your vulnerability, we truly learned a lot from you today. So again, thank you so much. And thank you to all our panelists as well. I do want to save some time so that we can open up the floor for questions from our audience who's joining us today. I'm sure we have a lot of questions to go through.
Welcome back, everyone. We appreciate your interest and engagement so far. We've had a lot of insightful comments in the chat, and we've got some questions that were also shared with us during the pre-registration phase. We're going to try to get through as many as possible. We're going to focus on questions that are relevant to the pre-transplant phase as they relate to the recipient and living donors. So there were some questions that are more program related or research related. We're going to table those for potentially future webinars where we're going to discuss some of these aspects, but today we're going to focus on the recipient and living donor. So I'm going to start off with a question to Michael. We have a lot of audience members who were curious, like, in terms of like dollar amounts, and I know you've kept some really good record keeping, what would you estimate were your typical out-of-pocket costs in different categories as you were preparing for your transplant journey?
So when I was first going through everything, I spoke to the financial coordinator. She gave me a heads up that I would probably need somewhere in the range of $25,000 to $30,000 to really cover my transplant. That was with my insurance. Now I had already reached my deductible when I had my procedure, because I had my procedure in October. So I had already gone through, most of the year getting up to that point. So you got to figure I spent a couple $1,000s already prior to that. And within that year, I remember I probably spent about $1,000 on medications beforehand. And I know that changes from person to person based on certain diagnoses. Like you heard Jen and I talking about some of the blood thinners as well. So that was and my GoFundMe raised a little over $20,000, and that covered a lot of post-transplant things. So pre-transplant, yeah. Plus you got to figure the travel was about another $11,000 between hotels, traveling, gosh, all the some other appointments, imaging, blood work. And also because I was traveling, my insurance would only cover things that were in South Carolina, or like Blue Cross Blue Shield was only looking at things being covered in South Carolina. So when I went up to New York, it was a different fee, even though my doctors were in network. It was, sometimes I got some surprise bills because I thought people were in network, and they were, but because I was out of state, it changed. So yeah.
Thanks, Michael. And Sarah, I know you're a liver transplant doctor, so you take care of patients with a variety of insurance plans. So Michael, shared his experience with his plan. From your experience as a provider, what sort of ranges have you seen your patients deal with?
Yeah, certainly trying to estimate what you're going to spend pre-transplant for the evaluation and waitlist is really challenging. And I think there isn't as much research out there to kind of give us numbers about what patients are spending, especially given transplant waitlist experiences are so variable. Some patients are on the list for months to years, while others are being evaluated in the hospital. But I know we had a lot of questions about what to expect or plan for post-transplant, and I do think we have not only experience center to center, but some published, data on what to expect. And the challenging part is that insurance matters, and I think we all know that, and patients know it firsthand from their personal experience that your insurance dictates what you pay, unfortunately, in the US. But what we can advise our patients is that I think, as Michael mentioned, planning to spend preparing to have $5,000 to $10,000 available to spend after transplant is wise. And there are some studies to show that those patients who are older have other medical problems, including liver cancer or hepatocellular carcinoma, or are listed for a combined liver kidney transplant needing a dual organ, will probably incur more costs. And when we look at some of the data there, we see that about $1,000 out of pocket is typically spent for medications. This is post-transplant in the first year after your surgery. But I think what's difficult, and Michael can, has spoken to this, is the unexpected costs related to travel, lodging, and time off from work. I think that's where it's really hard to put a number on. I think that is what's comprising a lot of those out-of-pocket expenses that Michael mentioned, and having a source, whether it's through fundraising or savings of at least, $5,000 to $10,000 is really helpful.
You can always ask for like a good faith estimate prior to. That was something I learned after the fact of I should have done that, especially being everything I tracked on an Excel sheet, because that's just how I operate. But I should have done that before. And so I would advocate for folks to look into that. And again, like, don't be afraid to ask questions. Don't be afraid to call your insurance company and say, hey, I received this bill. Can you explain it to me, right? You don't have to be negative towards them. They'll be more than happy to explain it to you and why that is. And that'll help you plan ahead as well.
And I think in terms of planning ahead, it's also important to consider for what insurance will cover. is that something where where your insurance company will foot the bill up front? Or is this something that you have to pay out of pocket first, submit receipts, and then you have to wait for this to come back from insurance as well? Just anecdotally, I know that's something that we always try and clarify with patients, with our transplant financial folks and our social workers when we're considering them for transplant evaluation, much less listing. But that's always an important thing to clarify from an insurance perspective as well.
So I wanted to hear from Gloria about the social worker perspective. So from your experience, taking care of patients presenting for probably a variety of organ transplants, how do you assess the financial burden? Like, what do you see as the most challenging categories of burden that patients go through? And how do you kind of help patients navigate this, this landscape?
Yeah, great question, Isa. And while don't represent all social workers, I do see a lot of social workers in the chat, so I just want to shout them out. The financial burden that I see a lot of patients go through after transplant or even before transplant mainly is around hospital bills, medications, and some of the travel burden. And travel burden can be more specific to the regions that I've been privileged to work in. But hospital bills and medication costs are the most things that patients deal with and have a lot of burden around. And so a lot of the, or part of the transplant social work evaluation, a component of that is financial assessment of their resources, looking at not only what their income is and their expenses, but also what they have available to them. And so I know that transplant financial coordinators are also a valuable part of our transplant team, and they also do their financial assessment as well. I know that the financial assessment can vary across different programs, and I do agree. I know that there was a comment in the chat about having more industry standards of the financial assessment, which I agree with, to help really prepare patients for transplant and also mitigate some of the disparities that we might see with transplant access. But I think collectively, transplant financial coordinators and social workers are available to patients and can work together to help patients prior to transplant, even after transplant, find resources to address some of the burden that they are faced with hospital bills and medication copays.
Thanks, Gloria. Now, we do have some certain special populations that may have even more challenges. For example, people who are uninsured or people who are not U.S. citizens or from out of the country. Do you have any general advice for such segments of the transplant community?
Yeah, it's tricky, especially for those patients who don't have insurance. As we all know, transplant surgery is very costly. Depending on the organ, it can vary from $100,000s of dollars to even $1 million. And there are resources available to help patients who are uninsured in the United States to get health insurance. You can work with your transplant financial coordinator and the social workers at the transplant centers who are available to help provide guidance and help you navigate getting insurance through the marketplace. This is, though, specific to the United States. And a lot of the resources that I'm aware of that are available are unfortunately US specific. I would say for our international patients or donors, fundraising probably is the best avenue to help with some of the financial burden. But for those patients who have a social worker or financial counselor available to them within their transplant center, that's who I would advise first directing all your questions to, because they are, again, available to help and provide resources too.
Thank you. Along those lines, we just got a question in the Q&A, and this may be different from one center to another. At your center, at least, is there a Medicare specialist, or is the Medicare and SSI guidance navigated by the financial coordinators and social workers?
Yeah, that's a great question. We don't have a specific Medicare specialist at our center. It is a combined effort between our transplant financial coordinator and social worker who help navigate the patient through the Medicare application or disability application. And so I know that that can be center specific. And so it just depends on where you work and which center you are accessing transplant through. I would speak and ask to speak with both to get guidance.
Thank you. Michael, I wanted to come back and ask you a question about your experience. I know in your journey you had a living donor. So did that impact you in any kind of way as far as financial responsibility towards the donor? Like, how did living donation impact your sense of financial responsibility?
Yeah, I felt a lot of responsibility. At first, I didn't know how it worked, but I felt a lot of responsibility of like, well, this person's going to possibly give me the gift of life here. I should probably pay for everything this person does from now until, you know, the end of time. So I actually contacted my insurance company when I decided that I was going to go down the living donor route to ask them how that worked. And also, like I said, I have my transplant done at New York Presbyterian. They also contacted my insurance company for me when we went down that route. And I was told kind of the criteria of what they would cover on the living donor side. So they covered most things during our actual procedure, but pre-transplant wise, I believe they didn't cover everything, but they covered some things having to do with his evaluation. But I was also not allowed to cover anything for that because, you know, it's not allowed to, you know, that'd be like giving preferential treatment. So, it was hard though, because I wanted to help, right? So my insurance covered most of his expenses for the actual transplant itself, but he used his insurance to help cover some of the evaluation as well. But he did have to travel, and that was something we kind of had to navigate too. Because he lives in Illinois, so he was traveling to New York for that. And so, you know, we eventually used the GoFundMe, not just for me, but kind of like for us in that journey too. So then we kind of helped it for some of his out-of-pocket costs, and including like similar things I had to face too, like being out of work, and possibly any other complications that might have occurred as well.
Thank you. Now I'm going to ask the providers in our panel, like in your experiences counseling potential living donors that come forward, you know, for this selfless act, what sort of advice have you provided them as far as, you know, claiming disability or FMLA and things like that? What has your experiences been like?
Can't entirely answer that precisely because it is a little bit different for each patient. The one thing I will say is there are these, especially with in the kidney space with paired donation, there's large kidney paired programs. There's several of them. They do have like donor pledges or donor protection programs that can offset some of the donor travel expenses, wage reimbursement for up to, I think it's 4 weeks. And so there are some additional programs to help, exactly like you said, Michael, to be able to, like, you want to be able to help offset some costs for donors. So some of those programs can also be helpful. And then there's also the NALDAC, the National Living Donor Assistance program too, that can sort of offset some of those costs too.
I was going to chime in for my liver transplant patients. You know, the question about disability, FMLA is really challenging because I think so much of our care up front is focused on getting on the wait list, getting to transplant. And we sometimes don't have enough time, whether it's in clinic or in the hospital, to talk and anticipate the recovery after transplant and potential time off needed, unexpected complications. And so I really try to tell my patients, if you're able to continue working, obviously that's always the best option, not only for daily activities, but also maintaining benefits. So we can save that time and resources for after transplant, but it's a really individualized conversation where it's really important to engage our social workers and think about who else in the household is providing financial support, and how much is employment falling on the patient and is needed to help support the pre and post transplant care. There was a comment by a provider about how oftentimes I do think providers are not aware of the day-to-day struggles of our patients before and after transplant. And I wish also that sometimes my patients spoke up about some difficulties, even with, for example, getting labs on a weekday versus a weekend. I've had patients, wait till till I've known them for years to tell me, hey, can we alternate to telehealth so I don't have to take a day off from work to come to the clinic? So I think really, as Michael said, advocating for yourself. And if you're unable to, really trying to delegate someone to advocate for you, like, hey, this is hurting us in these ways. Can we work with our provider, our transplant team, to tailor the care so that it's not adding undue and additional burdens? I think that's where, from the provider standpoint, we need to do a better job working with our patients to reveal those daily challenges.
Isa, I would also add into that my donor, and this was also region specific or hospital specific, sorry, he applied for a grant that because he was a living donor for liver specifically, he received money as a reimbursement for his travel and some of his other medical expenses as a part of the process. And that actually had to happen post-transplant. So he had to keep receipts and everything for the evaluation and during our procedure. But afterwards, he was able to submit a lot of his receipts, and they gave him like an allotment. I think the allotment was several $1,000s that he was able to get reimbursed after the fact as well. So there are financial programs for the living donors as well too.
Thank you, Michael. I think we have time for probably one more question for our entire panel. There is a lot of concern with the changing political landscape that there could be cuts that affect Medicaid, Medicare, health insurance coverages, and things like that. So what sort of advice do you give to our transplant community in terms of how to navigate those potentially challenging times?
Obviously, everyone wants to chime in and talk about uncertainty and finances in the state. I think all of us, patients, providers, the transplant community, feel a lot of fear and uncertainty about this, the finances moving forward in this field. I think, though, for a lot of us, it comes down to patient care and doing, everything we can to support patients' families in this transplant journey. And so I know many of us in the transplant community are committed to whatever it takes to help our patients. And I do think this is a good time to really think about more advocacy and how patients can be their own advocates, caregivers and families can advocate, and transplant team members really can advocate for the needs of our patients and what they need in the transplant journey. And it's a really important time where I think other groups can step up and try to fill in some of these gaps where we need better support for transplant recipients, donors, including the unexpected costs related to going through evaluations, transplant and lodging, building community. I think there's a lot of ways to build resources and support that aren't always contingent on insurance and contracts and government plans. But I know this community is gonna keep supporting each other to move forward.
And like Sarah mentioned, I think communication with your providers as well for patients to be open. I think that's also really important for us, just so that we're aware and we may know of resources or you may bring up things that we haven't thought about before, either when we're taking care of you or so that we can be more flexible, like Sarah, you mentioned with, alternating with telehealth or knowing that someone does need extra assistance. And that does mean that we need to get our social workers more involved, or this wasn't brought up during evaluation because that was 9 months ago and they're still waiting for transplant. Circumstances can 100% change throughout that time. And, it's, also with our transplant coordinators I know it's institution dependent, but I think we all have the same goal here from a provider perspective, from a transplant team, and from a patient perspective is because we care.
Thank you all. We are at the top of the hour. So I would like to again take a moment to thank you all for your insightful comments and conversation. I want to thank all the audience members who joined us live today and had a great interaction and great questions with a very stimulating discussion. We covered a lot of ground, but we're just getting started. So stay tuned for our future webinars, and we're going to visit other topics related to the post-transplant phase, specifically to the living donation. And we look forward to engaging with you again soon in the future. Thank you all.
AST would like to thank Dr. Ashur, our wonderful panelists, and all of our attendees for today's session. Please look for an email from Zoom in about a week directing you to a copy of the on-demand recording available for free. Finally, please remember to complete the evaluation survey in Zoom. Thank you all again for today's excellent session.